Hello, Don here. Welcome to Podiatry Practice Mastery, where we're helping you get your practice to the $1,000,000 mark and beyond. I want to go over today what you should know. What are some of the questions that you should ask before you delve into buying a Shockwave machine? And I find that many doctors, they either buy the equipment and they're not really sure how to use it, or they buy the equipment and they're not really sure how to kind of have patients opt in for doing the Shockwave. Okay, so these are some of the challenges that I see. So I'm going to try to go over some of the common questions and maybe some of the solutions that might work for you. I do have a doctor coming in this week to shadow me about doing Shockwave. So if you wanted to come and visit, certainly reach out to me, Don at podiatrypracticemastery.com. I maybe do between 3 and 4, 5, 6 per day. And it really is I would say probably the number one thing in the office that's generating cash pay revenue for us. Certainly there are other things that you could try, but for me it's that. I know for some of the doctors it might be orthotics, but for me it is the Shockwave. So happy to share, and if you have any other questions that I didn't include here, please let me know and I'll do another episode. So I would say the first Shockwave checklist question would be, are you able to sell the treatments to patients? And I know sell, we don't like this word in medicine, but really all sales is helping patients to make a decision to do something that would benefit them. And if we're not able to do that for Shockwave, you're just going to have a machine that you're never going to use. And I feel like there are many doctors that have these machines and they're underutilized. And I think one of the issues is if someone is just so busy, they don't have time to explain it. They don't have time to really answer any questions for patients. Many times it's underutilized. So I think I don't like the word sell. I like it. It's part of the way I do things in the practice. If you have listened to anything that I've said here, I tend to do the first visit. I do some of the traditional treatments, and then I say that's phase 1. And then if it's not getting better in 2 weeks, we'll do an ultrasound, and then most likely we'll do the Shockwave. And for the most part, it sells itself. Patients, they want to get better. I really believe in it. And I think even more so than being able to have patients decide is they see your conviction that the machine actually works. There was a doctor that came and visited me a while back. He got one of these, I guess it looked like kind of a radial pressure wave device from China for like $300. And he was like, yeah, I don't know why none of my patients are accepting this. And I said, well, really, it's not a very good tool that you're using. You don't really believe in it. And I think a lot of times doctors want to go the cheap route. And if you do that, it's just not going to be a good thing. Okay. I think the second thing to ask yourself in your checklist is, will a technician perform the treatment or will the doctor? There are a couple ways to think about this. I tend to be an early adopter of technology, but a slow adopter to have staff. And that might not just be because of me. It's probably because I have some partners. Like it took me like 5 or 6 years of thinking about a scribe to actually getting a scribe. And now that I have a scribe, I wish I would have done it a lot earlier. Took us many years to get a nail technician, and I kind of wish I had a nail technician many years ago. Same thing with Shockwave. Currently, we're still doing Shockwave. So if I'm doing between 3 and 6 per day, I think I could see 3 to 6 other patients a day if I had a technician doing it. And there's a lot of different ways that you can do that. You can use your current medical assistants. You can have, for example, a block time where they would just come in once a week and have maybe a physical therapy assistant or a massage person or someone else kind of doing it, or you can just use the current staff. There's a lot of questions that you would figure out as you start to do it, but you have to figure out, will the technician do it? The best one I like is okay, if I do it, it's going to be $250 a session. If we have a technician do it, maybe it'll be $200 or something like that because my time is more limited. And to have a technician, just like anything else, it's going to take a long time of shadowing you because they have to not only learn how to do the treatments, but they have to learn how to answer the other typical questions that come in. Next question is, do you have patients with tendon issues and fasciitis? And then the subsequent is, can you stop doing cortisone and offer Shockwave? I think most of us, if we're podiatrists, we have tendon issues. So I always think that when you're starting Shockwave, the best thing to treat is bulbous Achilles tendinopathy, plantar fasciitis, peroneal tendonitis, posterior tibial tendonitis. Now these a lot of times aren't using just Shockwave alone. You are using it in conjunction with either orthotics or an AFO or something to stabilize the abnormal movement of the foot that can aggravate these. And so it's not just Shockwave; it's the whole kind of the treatment protocol. But for tendon issues, I used to do just cortisone, orthotics, and then physical therapy. That's how I did it. And some patients got better, but a lot of them didn't. And many times they would have to have repeat cortisone injections. And depending on the thickness of the fascia, this is what I learned now. If the fascia isn't that thick, then sometimes cortisone can work. But if it's very thick, it does a good job at reducing inflammation, but it doesn't really heal the tissue or repair the tissue. So can you stop doing cortisone? I know many doctors, and this is something I did in the beginning, is they leave Shockwave for the last treatment option. And I've mentioned this before, but I'm just going to reiterate. A lot of these self or cash pay treatments, many times we want to leave them for the last. Well, really, you're trying them on the hardest patients that are probably going to have the least success of having them. I move them all to the front now. I try some initial things, and if it's not getting better, I say, hey, we can keep doing this. We can do PT, or we can do this thing that works. And you have to have a wording phrase, and my favorite wording phrase is it's 82% effective, and it speeds up the healing by 50%. And then I think another thing is, as you're doing it, you have to learn to set expectations, because many times I get phone calls of maybe patients that are treated by other doctors, and they don't really go into the whole, like, how long it takes for it to actually start to work. I think that's another issue. So if you have patients with tendon issues and fasciitis, that maybe you're not doing cortisone, maybe you're doing, I don't know, cam boots, or maybe you are doing cortisone, I think those are the prime patients that you could do Shockwave for, and patients would certainly accept it, because many patients know that prolonged use of cortisone isn't good for them. The next one would be, do you have an ultrasound, and do you use it? Many doctors maybe have an ultrasound. It's an older version. It's very poor visualization. They can't really see anything on it, neither can the patients. You have to have a good ultrasound, and there are some super cheap handheld ones. And even if you're not billing insurance, you can do these handheld probes with your cell phone or an iPad, and it's very, very good quality. And this is the number one tool I could say that helps me do Shockwave more than anything else. It's showing the abnormal pathology on one foot versus the other. And so if you have an ultrasound, or if you don't, I would get one and learn how to use it. In the beginning, I just did ultrasounds on everyone so I could learn how to look at the abnormal pathology. Many times I'll still do it today, and you can do it for, if you're doing injections, ultrasound guided injections. For Shockwave, it's to look at the tissue, and you can look at it pre and post. I don't always look at it post, especially if they're getting better. I'm not as interested in showing that, but if it's not responding, I'll do another ultrasound. And once again, the best way to learn is to buy it from a company that has some training. There are tons of training videos online as well, and really the best thing is just to try it. The next question is, will you start with a radial device, or will you get kind of focused Shockwave? So explaining the newest theory at this recent conference is there's radial pressure waves, and then there is actual shock waves. So there are many different systems. They are all good. We have two different systems. We have two radial pressure devices from Storz. We have one focused Shockwave, which is a Storz device, and then we have a soft wave, which is a non-radial device, which we call broad focused. And they all work really interchangeably, I feel. And so it's really which rep does the best job. We interviewed the different companies. There are many different companies out there. I'm going to give a shout out to Zimmer, who's out there now, and there's some other type of brands. I really think they work interchangeably, and really what helped us make up our mind, and so if any reps are listening to this, is they let us use the device. So they had like a loaner device, and they let us use it, and we tried it out on patients, and we tried, I think they left it for a month or something like that, and they probably just had these loaner devices going from practice to practice, and we did not charge them. So in the beginning, when we're doing the loaner, we didn't charge them. We just did the Shockwave. We did it weekly, and we saw the improvement, and so it built up our confidence in the device. And so I would recommend, if you're starting out, you're strapped for money, you may want to do just a less expensive radial device or radial pressure waves. I always say that for radial, you can do about 80% of what we do in podiatry. The tendinopathies, the plantar fasciitis, the things like that. And then as you get more experience, then you can go to the focus. That's what most people do. If you have the money to buy both, you can buy both. If you want to buy one machine that kind of has both together, that would be the broad focused type of devices. That would be a soft wave. So it's like one device, a little bit less than putting them both together. We just happen to have both, so that's why we use both. So it's really up to you how you want to do it, but you do need to invest, and maybe talk to the reps. Hey, do you have a trial device I could try for a little bit and just do all your patients and see how that works? Are you willing to invest in new technology without the hopes of insurance coverage? And this is another question, because I think many reps, they try to sell it on, insurance will cover it. What I'm finding is that even if insurance does cover it, it's not going to be worth it. So it might be like $130 per treatment. And if you look at the expense of the device, and if you look at the expense of your time doing it, I think it's going to be beneficial if we have to start doing it through insurance, would be having a medical assistant do it, but not our time. So You have to be willing to have this be covered as a self-pay versus insurance. I don't think the insurance is really going to make a ton. I know some doctors are doing this. I've heard some interesting things like with Medicare, they're doing it on neuropathy or doing it on a lot of other things. I do not do it. I do mostly musculoskeletal things. But you have to be willing to be able to make that payment, whatever that is, based on using it. And that's where I feel, maybe a single doctor, unless you have a sports med practice, it may be a little bit of a challenge. So we have multiple doctors using it, makes it a little bit easier because you're spreading that cost out amongst other doctors. Next question is, do you believe it works? And I think this is the number one in terms of getting patient acceptance. So if you believe it works, and if you see it in your patients, then you will do it. So you'll develop what we call pattern recognition. So you're going to recognize in the plantar fasciitis patients, this is what works. On Achilles, this works. Insertional Achilles, this works. And you're going to get more and more confident in setting up patient expectations. And I think that is the number one. And so probably the easiest way of getting that confidence that it works would be visiting another doctor and seeing their patients, and then borrowing a device or just doing a device and learning how to do it. And then have you visited a doctor that does a lot of Shockwave? I think this is the key. That's why I'm inviting you to come visit me if you want. You can go to Podiatry Practice Mastery and email me, and I'd like to have you come in because you can see you don't have to be that heavy-handed. It's not going to hurt a lot. I know many patients in the beginning when I first started it, they were in pain. I had some pass out because I was too heavy-handed, and I find the longer I do Shockwave, the lighter I go, and I still get the same results. So these would be the Shockwave checklist of questions before you buy a Shockwave. These are some things I would ask yourself. I am putting together on Podiatry Practice Mastery a kind of a little Shockwave course. It's not quite done yet. I think it'll be like podiatrypracticemastery.com/Shockwave, and then there'll be kind of resources there, kind of like this, probably like this podcast and other types of resources to help you make the decision and help you kind of determine if you can afford it. There is I put together a while back an Excel spreadsheet that you can kind of put in how much you would charge, how many patients you would do per week, and how quickly the return on investment that would be. I have a little Excel spreadsheet. So if you're interested in that, shoot me an email, Don at podiatrypracticemastery.com. Happy to send that to you. Once again, hope you guys found this beneficial. We'll talk to you soon.